Good evening and welcome to SCAS, the Society for Companion Animal Studies. And thank you to Evangelos Diamantakos for presenting this webinar, the first of an exciting new series of SCAS webinars. These will be delivered approximately monthly, once a month on the first Thursday of each month, except for August and December this year. There is much very important work in this field which we wish to share with you. If you have questions that arise during Evangelos' presentation, please post these into the public chat. A selection will be posed to Evangelos during the live Q&A session at the end of the presentation, and he will answer as many as possible. He can answer other ones in our website afterwards. Please only use that public chat for posing questions to the speaker to enable us to keep a track of them. Other problems or concerns during the event, please send a private message to SCAS Administrator by clicking on the SCAS Administrator name in the list of users and select Start a Private Chat. Evangelos Diamantakos, Evangelos, has a background, an extensive background in canine behaviour, training, welfare and academia. He is a trustee of SCAS and is an ABTC registered Clinical Animal Behaviourist and is a full member of the Association of Pet Behaviour Counsellors. He has authored several books and sees dogs on referral from veterinary surgeons. In this webinar, Evangelos will discuss stress in dogs involved in animal-assisted interventions, including what the stresses can be, how to recognise stress signals in dogs, and what steps can be taken to mitigate against these. Welcome, Evangelos. We are looking forward to this webinar, Dog-Assisted Interventions, Recognising Signs of Stress in Body Language. Thank you.
Thank you, Liz. Good evening, everybody. My name is Evangelos Diamantakos. I'm a clinical animal behaviorist and a dog-assisted interventions facilitator, designer, and researcher. I've been working with dogs and people who love dogs for more than 30 years, and I feel very fortunate about it. I'm delighted to be the first presenter of the SCAS educational webinar series, and I hope you enjoy this presentation. The title of this presentation is Dog-Assisted Interventions, Recognizing Signs of Stress in Dog Body Language. The beneficial effects of dogs on humans across the lifespan is very well documented by present literature. The introduction of dog-assisted intervention programs in educational, care, health, and other therapeutic settings is gaining ground both in the UK and internationally. The training and participation of dogs in these programs is very demanding. It needs special preparation and should be designed by a team of professionals who will promote both dog welfare and human health and safety. Unfortunately, not all programs operating in this field are following guidelines issued by organizations like SCAS. Others lack the contribution of accredited dog behaviorists in their design teams. The aim of this webinar is to raise awareness of and promote dog welfare during training and participation in dog-assisted intervention programs. The webinar will provide basic knowledge and help all those who are interested in DAIs, dog behavior, and training to recognize DAI terminology and identify training needs, explain the function and factors that trigger stress behavior, describe the signs of stress in dog body language, and understand the general guidelines to avoid stress in DAIs. The main topics discussed in this presentation are dog-assisted interventions, what stress is, signs of stress in dog body language, and general guidelines to avoid stress in DAIs. According to the American Veterinary Medical Association, dog-assisted interventions is a broad term used to describe the utilization of dogs in diverse manners beneficial to humans. At this point, I need to say that we at SCAS would prefer to replace in this definition the word utilization with that of participation or involvement. Animal-assisted intervention programs have been operating for at least the last 30 years, and much research has been done on the positive contribution of animals, and most particularly dogs, on the physiological and psychological health, education, and well-being of people who participate and benefit from them. There are three main categories of dog-assisted interventions. Firstly, the dog-assisted therapies, which take place in various health, care, and therapeutic settings. Secondly, the dog-assisted education programs, which operate in various conventional and special education settings. And thirdly, the dog-assisted activity programs, which are operating in a wide variety of settings, including those mentioned before. In order to get a better understanding, let's take a deeper look at the basic participants of these three different categories of dog-assisted interventions. In the DAA, we have the dog handler, and the benefited participant or participants. This intervention is a structured activity of dog-human interaction, which aims to benefit the participants in a multidimensional way according to the program design and the characteristics or needs of the participants. A DAA program does not necessarily have a direct therapeutical or educational target, though it can hugely contribute to the participants' psychological uplift, body activity, health condition, learning engagement, etc. The facilitator of a DAA program is not necessarily a health or educational professional, However, they can cooperate with those professionals in order to assess and measure the effects of the dog-assisted intervention program on the participants. In contrast, the dog-assisted therapy program not only has the previous mentioned basic participants, but also a health or a team of health professionals who are the facilitators and work on a specially designed therapeutical plan with certain therapeutical goals. Likewise, in the dog-assisted education programs, we have again the dog handler, and the benefited participant or participants. However, in addition, we have an educational or a team of educational professionals who are the facilitators and work on a specially designed educational plan with certain educational goals. According to the SCAS code of practice, dogs participating in dog-assisted interventions should be specially trained and behaviorally tested. Therefore, the dog handlers should be specially trained so that they can guarantee and promote dog welfare. I need to emphasize here that not all dogs can meet the criteria of becoming a therapy, educational, or activity dog. The training of these dogs is very demanding. The same way, a dog handler should be trained for this demanding role and, among others, should be able to recognize dog stress in order to change or stop the procedure when necessary. This is absolutely essential and required for an easygoing and humane participation of dogs in these intervention programs. For those of you who are not SCAS members or are not aware of the Animal-Assisted Intervention guidelines, you can visit our website where you can read or download the SCAS code of practice for more information about it. We at SCAS are very proud of its content, and we hope that it will help and contribute to develop safer assisted intervention programs for both human and dog participants. Going back to dog-assisted interventions, and in an attempt to present and summarize some aspects of the very demanding training needed, I could briefly say that dogs should feel calm, safe, and confident when participating in various events, situations, and procedures during their interaction with people, and during familiarization with various items, equipment, and different indoor and outdoor environments. Therefore, among others, they have to get trained and get familiarized with different ground surfaces and floorings, various human appearance characteristics, different human clothes and accessories, furniture and special equipment in the home, health, protection, care, and educational settings, human presence where no physical interaction is allowed, noises and body contact during interaction with people at a very close proximity, and human movements that sometimes may be very sudden during interaction at a close and very close proximity. In the case that dogs are not appropriately trained and in one or another way are forced to participate in dog-assisted interventions just because they're good and friendly with other people, or because their owners have as a solely purpose to utilize them in order to benefit our fellow humans, then all the previously mentioned forms of interaction may potentially put the participants at risk and cause high levels of stress in dogs. Stress, it's a word used frequently in the busy lives we all live, but what does it actually mean when it comes to animals? According to the HSA organization, stress occurs when animals have to make extreme and/or prolonged physiological and behavioral adjustments in order to cope with their environment. There are three different categories of stress. Physical, due to fatigue or injury. Physiological, due to hunger, thirst, or temperature control. And behavioral, due to the environment, unfamiliar people, or surroundings. For the purpose of this presentation, it is the third category that is of interest to us, that of behavioral stress. This is what we, dog-assisted intervention handlers, trainers, behaviorists, facilitators, and designers are called to mitigate in DAIs. So, we could argue that the third category, the behavioral stress, is the emotional state of feeling tension when facing or dealing or expecting to face or deal with a challenging, demanding, or dangerous situation. Or I could add here a perceived challenging, demanding, or dangerous situation, which is what is happening in the most of the cases during dog-assisted intervention training. For example, an oxygen mask, a crutch, or a school desk used by a benefited participant may not be dangerous for a DAI dog, but they need time and several positive associations so that to understand so. Nevertheless, stress is absolutely essential as a coping behavior mechanism. This is because it is hugely important for facilitating and ensuring the basic instinct of survival. It helps animals to avoid danger or satisfy a given need or demand. And as we will see in the next slide, when it occurs at a low or low-medium levels, it may act as a preparatory stage in order to process, assess, and evaluate a given situation and respond accordingly. I would like to show you a flow chart that I have drawn so that to depict the very basic stages of stress in dog behavior. As you can see, at the very beginning, there is a stimulus from the external environment, a body function, or from a memory recall retrieval that triggers stress. This stimulus increases the dog's levels of arousal or alertness. At this point, the dog processes the information and exhibits a coping behavior. If this coping behavior turns out to be effective, then in the meantime, the dog experiences low or very low levels of frustration or anxiety. However, if the coping behavior is not effective, then they will try a different coping behavior if that is possible. In the meantime, the stress levels are increasing. If this new coping behavior is effective, then the stress levels will decrease. If not, the stress levels will further increase and the dog will experience high or very high levels of anxiety and frustration. You may be asking, what impact does this have? Well, in the worst case scenario, this may end up with the dog in panic, phobia, shock, or even collapse. I would like to mention again here that this flowchart depicts some very basic and simplistic stages of stress. It does not show further details, nor provides more specific information about the cases where animals, because of their health condition, genes characteristics, and/or previous experience, exhibit numerous variations in their behavior patterns and responses. A dog, for example, who has experienced a very negative interaction with a child, next time they see this child, may exhibit instantly high levels of frustration or anxiety and try to escape or bite them. Although when I initially introduced the concept of behavioral stress in dogs, you might have immediately thought of something negative, from this discussion, we can see it could be argued that we have two different types of stress. On the one hand, we have the positive stress, where we see low levels of stress, absolutely essential and vital for meeting satisfying everyday living demands or needs. And on the other hand, we have the negative stress, where we witness medium or high levels of stress, which are detrimental for the physical and mental health. It's worth mentioning here that the words low, medium, and high are wide terms which are often used to describe how we humans measure stress based on how we perceive and interpret dog behavior. This very human perception and interpretation of an animal's behavior with whom we cannot fully understand and communicate, in association with the fact that the boundaries among low, medium, and high are vague and cannot be measured or estimated accurately, should always remind to us that assessing stress levels can be hugely influenced by subjectivity and anthropomorphism. The factors influencing stress and coping behavior can range from the stimulus characteristics, its appearance, size, the distance between the dog and the stimulus, any sound involvement and its volume, movements, lighting, etc., to the dog temperament, as this is defined by genes, previous health, emotional, and physical state. Regardless of the factors that contributed to the stress in dogs, there are three main stages of exhibiting stress when interacting or exposed to a stressing stimulus. At stage 1, the dog will freeze or fuff. At stage 2, the dog will exhibit a flight or fight response, or in other words, try to run away or reveal aggression in order to defend. If flight is not an option and or fight is ineffective, then a dog will exhibit extremely high levels of stress. In evaluating these details about stress, it becomes clear that body language is offering invaluable information about dog behavior. This can help us a lot when a dog interacts with or is exposed to various stimuli. In real-life situations, a dog's emotional state and thus behavior may change within seconds or even split seconds when they face a stressing stimulus. This can be best explained using the drawing on this slide. In drawing number 1, you can see a dog who is calm and relaxed. This emotional state may change very quickly, and so may his or her body language too. Body language changes and signs can be tiny, very few, and may be difficult to observe, like those depicted in drawing number 2. Alternatively, the body language changes and signs can be more and more easily identified, like those depicted in drawing number 3. Nevertheless, if you don't identify the stress signs in time, then you may end up with a dog who exhibits fear, aggression, or fight in an attempt to defend themselves. In the next 2 slides, I'm going to give you a list of the most common signs of stress in dog body language. These are yawning, eye blinking, avoid eye contact, nose licking, pawing, pacing, turn head and or body away, walking away, sitting and pawing, lifting a front leg, sniffing the ground or in the air, show teeth, raised hackles, and urinate. Here I need to emphasize that these signs may be revealed individually or in combination and can vary slightly different from dog to dog and according to the context. Many times, some of these signs, when revealed, are not necessarily indicators of stress. For example, a dog may walk away from a given stimulus just because they heard a noise and they decided to go and find the source. This is the reason we need to be careful when assessing dog behavior. Many times we will need additional information as far as body language signs are concerned. This information will be provided in the next slide. Before that, I need to share with you that it is common for a dog handler to find it difficult to observe their dog's body language. It is much harder for a handler who holds a dog on a leash to observe their dog's body language in comparison to another person who observes the same dog's behavior at, let's say, a 4 meters distance. The handler's body position, the height and the angle from where they observe, and the close distance they keep between them and their dog because of the leash, makes dog behavior observation a challenging procedure. But let me give you some more information about additional signs of stress we can identify in the dog body language. Beginning from the dog's body and legs, body is curled up, hands over, body with low center of gravity, unsteady pace, tense muscles, and may have sweaty paws. Continue with the head. Head is up or down, but very close to the level of the body. Ears back or slightly up, facing outwards to the right and left. Eyes with dilated pupils and looking around in case they need to escape. Unsteady breath with open or closed mouth. The tongue can be out of the mouth, side facing or licking the lips and nose, and may bark, whine, growl or howl. And last but not least, the tail, curved and or not wagging tail below the level of the body or between the legs. As mentioned before, at the beginning of this presentation, DAI training is very demanding, as it should be, in order to promote animal welfare and human participants' health and safety. Here are some general guidelines to avoid stress. Use training techniques and behavior modification programs based on reward provision methods. Never use adverse training methods. Set realistic and achievable goals based on your dog's temperament and abilities. The dog needs time to be gradually introduced into a wide range of different stimuli needed in DAI programs and acquire the level of training that will bring and guarantee the expected results. Monitor your dog's body language to identify quickly any signs of stress and stop the training process. Then you will need to redesign the training plan. Never push your dog to do something you think it is easy. Maybe it's not that easy for your dog and they need special training. And last but not least, ask a dog behaviorist to help you design the training plan. Ideally, this should be done prior to training your dog for dog-assisted interventions. Before I finish, I would like to share with you something that I have written in a book chapter of an Animal-Assisted Interventions book that was published last year. You can find it in the reference list of this presentation. The participation of a dog in an animal-assisted intervention program should not be an end in itself for the owner, handler, or steward, but a conscious and responsible decision based on honesty and ethical considerations with regards to the real training and behavioral abilities and limitations of their dog. There are many people out there who may have the best of intentions and want to benefit our fellow humans through the advantageous effects of dog-human interaction. However, this is not enough. A dog who is forced to participate in DAIs will not only feel at the very least uncomfortable, if not fearful, but may also stand as a potential threat to the emotional state and the health and safety of the participants. I would like to stress once again that the training and participation of dogs in these programs is very demanding. It needs special preparation and should be designed by a team of professionals who will promote both dog welfare and human health and safety. Unfortunately, not all programs operating in this field are following guidelines issued by organizations like SCAS. Others lack the contribution of accredited dog behaviorists in their design teams. If you share these ideas, you think that DAI programs should be very carefully designed and follow specific guidelines, then please help us to raise awareness of and make the SCAS code of practice known to the wider public. Here you can find some very useful references. And that's it. Thank you very much for your attention. And now I would be very happy to take your questions.
Thank you, Evangelos. That was really interesting, an excellent webinar. It's so important that people understand how to recognise stress signals in the dogs, whether they be therapy dogs or dogs that are companion in the home. If people understood these signals and could recognise the early signals and take steps to mitigate the stress, then human-animal interactions would be much happier. We'd enjoy better bonds with our dogs. We'd like to take some questions now. We have a few. Evangelos, I have a question here. Someone wrote, I adopted an adorable, friendly dog a month ago. Why the need to wait for the dog to be in my care for 6 months before he could be a therapy dog and visit my local nursing homes?
Thank you, Liz, and thank you for the question. I think that 6 months is a fair time so that to develop a healthy relationship with our dog and really understand which are their limitations and which are their skills. Because if we don't fully understand our dog, then we cannot guarantee the health and safety of the participants and our dog's welfare. This period is going to give us some time in order to work and train our dog appropriately, but also, as I said, to better understand our dog in order to guarantee successful dog intervention programs.
I have some questions coming up on more questions coming up on the screen. What recommended training for psychological therapists who work with registered therapy dogs? There isn't accreditation yet, is there, unfortunately, and I notice with COVID-19, SCAS has postponed their courses.
Yeah. That's why during my presentation I stressed the important work of SCAS with regards to the guidelines for animal-assisted interventions. There are many things that have to be done, and I think that all these areas related to accreditation for dogs, for handlers, for therapists who are deciding to include in their therapy sessions animals, all these are areas that should be find an appropriate solution in the near future. And that's why, because of the fact that this discipline is relatively new, there are many things that have to be done. So yes, we need time so that to develop the criteria and all these areas that are going to guarantee successful dog-assisted intervention programs.
I have another question about asking, is there any standardized course or certification in AAI, AAT? Many people practice in this area but haven't got any certification. Well, SCAS is actually working with others to develop certification, and we're also working with IAHIO to develop standards of practice that would be global. So it's a case of watch this space. There are a lot of people recognising that there need to be occupational standards in this field, and we are working on it. I have another question about why do I have to wait until my dog is at least 12 months old before he can start work as a therapy dog?
Yeah. First of all, as we said, as it was mentioned previously during the presentation, the training of a dog who is going to participate in these intervention programs is very demanding. So we need time so that to train and desensitize our dog appropriately to all these stimuli that are going to face later on during their participation in these programs. I think that 12 months is the minimum. From my experience, I would say that we need more than 12 months. Possibly a dog can be trained at this early age if the owner is a very experienced dog trainer or behaviorist. Otherwise, we need time so that to give the dog the opportunity to familiarize with all these challenging stimuli that they're going to face later on in their dog-assisted intervention career. So that's why the minimum age is 12 months.
Thank you, Evangelos. Here's another. Is there a recognised age at which dogs should retire from this work, or how do we gauge this?
Yes, I would say that there's not any, for example, our guidelines are not mentioning a specific age that a dog should resign, but I would say that from the age of 7, we should start thinking about how easy it is for our dog to deal with these challenging experiences and activities that they're involved during the dog-assisted intervention programs. I would say that if we start thinking about from the ages of 7, and according of course to the current health state of our dog, from the age of 9 years old, we should start thinking very, very seriously that the time to stop these interventions with our dog is something that is approaching very fast. But this is very much, it is very much dependent on the health status of our dog, and of course of how demanding is the program that our dog is participating in.
More questions appearing in the post. When you say some stress is vital, will they show any signs of this? My dog shows signs of yawning and scratching in the home. She's fleed, etc. Is this likely to be harmful stress that she is showing?
Well, thank you very much for that question. This is a very difficult question to answer because when we're trying to assess a dog behavior, we have to see as many things as we can. So it's the wider context which is going to determine if this stress is something really harmful for our dog. I would very briefly say that, for example, dogs who are participating in various sports, these sports or activities in one or another way are stressful activities. But as I said previously, we have to keep an eye and try to see if the dog is really struggling, if the dog is starting feeling frustration. But as I said previously during the presentation, observing our dog yawning doesn't necessarily mean that this dog is experiencing stress. But as I said previously, we need more information before we assess a certain behavior.
Jenny asks, are there currently any people offering this type of training for therapy dogs, or do we simply have to work out individually with a dog behaviourist? I guess that will depend what country you're in and at what state of advancement AAI is in your country. Any thoughts, Evangelos?
As I mentioned earlier, there are many things that have to be done. Unfortunately, this type of training is not provided by any accredited body. So that's why it's during these very initial steps of developing this area, it's very useful and I would say vital to keep a close communication and cooperation with a very experienced dog trainer who is going to help us a lot, and an experienced dog behaviorist. I would say that for those who are interested to acquire more information about animal-assisted interventions and dog-assisted interventions in particularly, they should try to keep contact with SCAS and other similar organizations, other international organizations like IAHIO, because from time to time, and actually before the COVID crisis, there were organized various events where people could see other professionals working in these areas and try to identify areas that need serious consideration and try to start from that and progress gradually.
Yeah, I have a question that I would like to answer, and that is somebody's asked that there are some programs that are not requiring that dogs not be fed on raw meat if they're involved in this work. People need to realise that dogs fed on raw meat pose greater potential of risk of zoonotic transfer, that is the transfer of bacteria and parasites that are harmful to humans. And the other risk, which is also very serious, is the risk of antimicrobial resistance transfer, that's AMR. If you check the websites of organisations like the Centres for Disease Control, World Small Animal Veterinary Association, World Health Organization, SCAS and IAHIO, you will see documents explaining this. If you go to the SCAS Code of Conduct, we've included some useful references that explain these issues. This is really important. To give you a useful analogy, would you prefer your house, your hospital, your nursing home to be wired correctly with proper earthing and voltage? Or would you be happy for dodgy wiring and for products with the wiring not to be earthed? That's the kind of risks we're talking about. You might get away with it, but you might not, and the consequences can be fatal. And in AAI, we are helping people that are many of them are immunocompromised, so we mustn't take any risks. I think that's been fantastic. A really, really useful webinar with excellent information. Our next webinar is on Thursday, the 3rd of June. And the talk is about the role of companion animals in healthy, active human aging. It's at 6 o'clock till 7 o'clock. And our speaker is Dr. Sandra McCoon. To register, go to the SCAS website, www.scas.org.uk, and follow the SCAS webinar link. I'd now like to encourage all of you who are not already to become SCAS members, to join our charity, support our work in advancing the human-animal bond. We take joy in explaining the important role of companion animals in society. And together with more members, we can improve the health, welfare and quality of life of both people and companion animals. There are membership discount benefits. These are discounts on our annual conference and on our webinars. You would receive a quarterly newsletter. You would become a member of a growing network of like-minded people throughout the UK and overseas. And networking in this field is really important because it accelerates your understanding. SCAS is a member of the global organisation IAHIO, the International Association of Human-Animal Interaction Organisations. In fact, we were a founder member of this in 1991. And As a member of SCAS, you become a member of IAHIO with additional membership benefits and a wider network with which to exchange information. To become a member, go to the website and go to the Get Involved section and you can join there. Thank you very much for attending. We welcome everybody in this field. It's a wonderful field of endeavour. And we look forward to seeing you at our future webinars. Thank you.
Thank you very much. Have a lovely day.
Thank you again, Evangelos. And thank everybody that attended. Great to have heard from you.